I'm here with Dr. Bonnie Henry on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As Minister Farnworth has said, heat warnings are in effect for some parts of British Columbia. The very high temperatures are expected to continue through the rest of the week into the weekend. At the same time, many parts of the province continue to experience the impacts of ongoing wildfires, which include exposure to poor air quality. I want to remind British Columbians, I don't think anyone needs a reminder, but it's important for us to consider these things right now, that extreme heat and exposure to smoke is hard on people's health. It's a serious risk, especially for our elders and those living with chronic disease. As we look forward to another few days of extreme heat, we're kicking our response again into high gear. The province is geared up and ready to help people through another heat wave. Along with our partners in the health authorities and local governments, we've lined up all of our supports again to protect British Columbians and their communities from the heat. All of our health services at our health authorities are fully prepared to help anyone who might experience heat or smoke-related challenges. In acute care, staff is being increased in ERs to meet expectant demand, and additional measures are being taken to keep people in hospital cool and safe. I want to note in particular the challenge faced in acute care at some of our interior health hospitals in Kelowna, in Vernon, and in Kamloops, who will know that some elective surgeries are being postponed in order to allow our staff to properly serve people under very challenging circumstances. You'll know the significant effort made, for example, at Jubilee in Vernon last weekend to prepare people for a possible evacuation. In fact, some people were moved. And that work, that pressure, and the pressure, of course, of the COVID-19 pandemic, which is especially affecting the Interior Health Authority, presents people in those hospitals with challenges. But they are there to serve you if you need them. And the important challenges and the important changes and adjustments are being made. In addition, with respect to surgeries, they have completed more surgical slates this summer than they normally would up to now. And this allows us some flexibility to make these changes at this time. In long-term care, workers will continue to take proactive steps to make sure residents are staying hydrated and keeping cool. In home care, caregivers will be checking for signs of heat illness and assist with getting whatever help necessary that their patients and their clients need. With respect to emergency health services, if you or a loved one experience heat-related illness and you need help, please call 911. The BC Ambulance Service remains ready to serve you. Paramedics and dispatchers are on deck to get help quickly to people who call for it. Provincial and emergency operations centers remain active. More clinicians will be stationed in dispatch centers again to make sure the response you get is the most helpful one. Managers will be working in hospital ERs again, which helps people who need immediate medical attention get out of ambulances and into care as quickly as possible, and helps keep our ambulances on the road. The Chief Ambulance Officer is also preparing paramedics to do their work in the hotter weather again, taking care of the people who take care of us. Once again, the ambulance paramedics of BC, QP Local 873, will play a central role in BC's emergency response through this heat wave. That means activation of on-call rural shifts to full-time for the weekend period, pre-scheduling overtime on a pick-a-partner, pick-a-time model, flexibility with pairing and utilizing EMR staff in the Lower Mainland from other areas by teaming them up with other paramedics such as ACPs and PCPs. Transfer cars for 911, the low acuity cars, will be staffed with EMRs and will be redeploying community paramedics as required. Managers will also be responding to 911 calls. The ambulance and paramedics will be going above and beyond again to get help to the people who call for it and to get that help to them quickly. And we are grateful and appreciative for all of the work, not just of the union, but all ambulance paramedics, of all managers, of all dispatchers across BC. With respect to Healthlink BC, at our provincial call centres, nurses at Healthlink BC are ready to handle higher than expected call volumes or higher than normal call volumes through Sunday. The province, of course, takes these heat warnings very seriously. We've had an all hands on deck. We have all hands on deck to get British Columbians through the heat, and our approach continues to be the same. Health services across the province have stepped up in a big way to protect you from the heat and smoke, and so have you. I've seen how British Columbians have been reaching out to support one another in the heat, reminding their neighbors and their loved ones to stay safe by keeping cool. Thank you for everything you're doing, every one of you, to take care of the people around you, people you know, people who may struggle in the heat, people with chronic diseases, our elders. And thank you to all of the healthcare staff and service workers who have been putting in extra work to keep people safe. And now I want to introduce our provincial health officer, Dr. Bonnie Henry, to give some more information to people about how they deal with these hot conditions and other important information for British Columbians at the time of this heat wave. Dr. Henry.
Thank you very much, Minister Dix, and good afternoon. We are dealing with challenges, as I don't need to say, on many fronts right now, both smoke and hazards from wildfires combined with unusual heat and the continuing challenges we have with this pandemic. As you know, Environment Canada has issued another heat warning for the coming days, starting today and lasting as long as through Sunday. This is particularly important in the central and southern Okanagan, the lower mainland, and the southern Vancouver Island areas, where we see forecast temperatures are rising in all of those areas. It is not anticipated to reach the same levels that we experienced earlier in late June, early July this year. But we do need to remind people the importance of taking care of themselves and looking out for others during these heat events. The very high temperatures are expected to continue through the rest of the week and into the weekend, and we know that these anticipated temperatures can cause negative health outcomes. Many people here are not acclimatized to this type of temperature, particularly when it doesn't cool down at night. We need to remind people that high indoor temperatures can be particularly dangerous for older adults, for those with chronic health conditions, and especially for susceptible people with health conditions who are living alone, who may not recognize the effects that the heat is having. We need to conduct regular checks on those of us in our communities, our friends, our families, individuals who live alone, particularly seniors who are at high risk of heat-related illness. We just don't manage heat as well as we get older, and we may not be aware of the effects it's having on our body. So there are things that we can do now, which is to identify people who may be more susceptible in your circle, in your community, to heat. Develop a buddy system and check in with each other frequently, particularly later in the evening and early in the morning. And check on people around you to make sure they're coping well with the heat. If you identify signs of illness, you can assist in moving people to a cooler, indoor, or shaded space, making sure they have water, making sure that they have the ability to cool themselves down. And as we heard, like the last heat events that we have had, municipalities across the lower mainland, the interior, and the province will have cooling spaces open and available for people and help to access them. We can also access air-conditioned spaces like malls, community centers, libraries, and we can assist each other to spend time in those cooler spaces if needed. If urgent medical support is needed, call 911 without delay. You can also, as we heard, call 811, our Healthlink, to get more information on things you can do to support yourself, your family, and others during the heat. The most important things are to stay hydrated, preferably with water to drink, even when you're not feeling yet that you need to have water, you're not yet thirsty. It can sneak up on us, particularly for outside or in a hot environment. We need to make sure we're keeping pets and young children cool, especially infants and children under the age of 4 who can heat up very, very quickly when temperatures rise. And of course, never, never leave children or pets alone in cars when it is hot outside. As I touched on earlier, accessible air-conditioned spaces are really important, and places where you can go to get out of the heat. So shopping centers, community centers, and I urge residents of family or friends to look out for those in your neighborhood, for those who don't have access to air conditioning. It's important to recognize that at high temperatures, fans alone can actually be dehydrating and may not be effective. But you can use fans effectively to cool yourself down by doing things like applying a cool water mist or a wet towel prior to sitting in front of a fan, or putting an ice tray in front of a fan, using a wet sheet or a wet shawl at night. Sitting in a cool or tepid bath to draw heat from the body into the water, or taking a cool shower are things that can help as well. And these are things we can help others to do if they're unable to do it themselves. If you have air conditioning, the other thing is to bring susceptible friends and family members to your house earlier, so that they're not subjected to the heat, particularly at night. Sleeping in the coolest room of your house, even if it's not your bedroom, is one thing you can plan for now. Sleeping in the basement, or if you have a safe place to sleep outside, can provide relief to the body overnight. We also need to remember to protect ourselves from the sun by staying in the shade, avoiding direct sun midday, wearing hats and light-colored protective clothing, using sunscreen. Although it won't protect you from the heat, it will protect you from some of the other issues around getting sunburnt, and wearing UV protective eyewear. Seek cooler, breezier areas when outdoors, such as large parks near the water or with lots of trees, and making sure you can use outdoor spaces like beaches, pools, and splash pads to keep cool. It is, as we know, things to keep in mind over the next few days also include, as I mentioned, dressing appropriately for the weather and keeping your house cool. Opening windows and doors when the outdoor temperature goes down at night in particular, and the below the indoor temperature. Shutting windows and closing curtains and blinds in the morning to keep the direct sunlight out of the house and the cooler air in. It helps. Using an air conditioner, as if you have one, as I mentioned, and preparing meals that don't require you to turn on the oven. These are all important things to think about that we can start planning now so that we can find ways to stay cool over the next few days. Also, consider avoiding tiring work or exercising in the heat, particularly outdoors in the middle of the day when the heat builds up. And always seek care if you need it. I'd like to wrap up by reminding everybody that there are resources available. We've heard from Emergency Management BC. They're also available on Healthlink 811, on your local health authority websites, which have information on the BC CDC website, information on what you can do in your home, with your family, with your community, and also where you can go to get more information. We've had alerts and bulletins going out yesterday and today, and these are the things that we can do now to get us through this next few days. I know with heat, smoke, wildfires, and the pandemic, it's been a lot this summer to take in. And we have to recognize it is hard not just on people's physical health, but on our emotional and mental health as well. We will get through this, but we need to support each other and take care of each other and do it as we have been doing, with kindness and compassion. Thank you, and we're happy to take questions. Oh, sorry. Go ahead.
I think there was an issue with the feed when Minister Farnworth spoke, so I'm going to send it back to Minister Farnworth for his remarks, which I don't think people heard overall. So back to you, Minister Farnworth.
Thank you, Minister Dix. I'm Mike Farnworth, the Minister of Public Safety and Solicitor General of British Columbia, and I'm speaking to you today from the traditional territory of the Musqueam, Tsleil-Waututh and Squamish peoples. And as you just heard, we've been joined by Minister Adrian Dix and Provincial Health Officer Dr. Bonnie Henry, and that for the third time this summer, a heat warming is in effect, and we want to let you know about a number of things being done to help British Columbians get through it safely. Emergency Management BC has been working with local communities and First Nations to ensure that they have the supports that they need. These include reimbursements for cooling centres that have targeted support for vulnerable people, transportation to and from cooling centres where no reasonable transportation exists, staff wages and overtime to compensate for the opening of civic facilities that would otherwise not be open, and water for distribution within those facilities. In addition, we will continue posting updates on local supports. My ministry's website, Emergency Info BC, is currently a hub for wildfire evacuee supports, but during heat waves, it also has links to resources on preparing for dangerous heat, information on heat-related illnesses, and cooling center locations which can help people to stay safe. People who are evacuated from their homes due to the wildfires are particularly vulnerable during this time, and local governments are being encouraged to let evacuees know where cooling centers are in their communities. We are asking everyone to plan ahead. Find out how you and your loved ones can spend time in a cool or an air-conditioned place. And has been mentioned by Minister Dix and the Provincial Health Officer, I encourage all British Columbians to check in with one another, especially with those people you know are living alone. Be sure to use the supports available and to take extra care of vulnerable people and families and friends and pets now and throughout this weekend. I also want to thank local governments and healthcare workers for quickly mobilizing to help British Columbians stay cool and safe through yet another challenging week. This summer has been a stark reminder of the impacts of climate change and the need to continue preparing for hotter weather and more difficult fire seasons as individuals and as a province. Thank you.
Thank you to our speakers. A reminder to reporters on the phone, you may now press *1 to enter the name. Be limited to one question and one follow-up today. Please also remember to take your phone off mute as you are not audible until your name is called. Our first question today is from Penny Daflos, CTV. Penny, please go ahead.
Hi there. Thank you very much for taking my questions. I don't know who wants to address this, but earlier you referenced the danger of heat indoors in particular, and yet I haven't seen any plans anywhere for overnight cooling centers. Even though high overnight temperatures are a potential factor in the deaths and illnesses we saw during the heat dome, why aren't there any beds set up at community centers, particularly for seniors, the disabled, or even those on medications that may keep their bodies from cooling down and don't have access to AC?
I can start with that, and that is a very good question. And I know in some communities they are looking at what are the optimal times, and you're absolutely correct. During the heat event, the severe heat event that we had in late June and early July, that was one of the unusual and defining factors, the fact that it did not cool off at night. And as a matter of fact, the heat built up later into the evening, which is something that is unusual. We're not expected to see that same weather pattern this weekend, from what I understand from talking with our weather experts. We do expect that there will be a cooling down in the evening, and I know that there are some of the evacuation centers, communal living centers, where they are looking at having that are making preparations for overnight, but I don't have exact details on whether communities are having evening or overnight cooling centers. I will say as well that what we have learned, not just from the experience that we had in late June, July, but also from cooling center use in other communities in Canada. Certainly I've been talking with colleagues in Montreal and in Toronto, that they are not often used overnight. People don't feel the need or they don't necessarily feel safe in using them at certain times of the day. So it is something that we're looking at. What is the optimal time and placement for cooling centers? What we do see is that people who are underhoused or homeless are often the people who are accessing them if they're in the right part of the community, and that many people use them for a short period of time and then go back to their own environment. So it does become really important for us to look out for people who don't feel comfortable using the cooling centers that are available as well. And I don't know if Minister Farnworth wants to add to that.
No, thank you for that question, and that's why. No, thank you for that question, and that's why EMBC has indicated to local government that funds are available to maintain facilities open and pay overtime if that's required. If a community wants to have a cooling centre that would be open later into the evening beyond hours that they normally would be open to.
Penny, do you have a follow-up?
Yeah, I do. During the heat dome, I should probably come as no surprise, even though it's gross, but profiteers were essentially scalping air conditioning units and fans so that anybody who didn't have hundreds of dollars to spend was out of luck. I can see now that the government is helping provide fans and other cooling measures for at-risk people, but it looks like it's mostly people that are already connected to the healthcare system in some way, whether it's assisted living or they have other community supports. So I'm just wondering what you're going to do to better support people who can't afford fans or air conditioning in the longer term or even beyond this week. I'm thinking the elderly, the disabled, other at-risk British Columbians who are consistently in danger from heat waves. I mean, as the minister said, we're number 3. We could have number 4 still again this year, and these are just going to become more common due to climate change.
I wonder if Minister Farnworth wants to address that.
Thank you. I mean, obviously, thank you. I mean, obviously, in a heat wave, we want to ensure that people are being looked after as best we can. And I think that's where it's critical that people go and check on their friends and their neighbours and invite them if they don't have air conditioning, for example, and do that regular checking up to see that people are okay. In terms of people wanting to gouge, that's just reprehensible. When people do that kind of when they do that kind of thing, and it really is quite shameful. Over the longer term, though, I do think that this is an area that government will have to be looking at as we see the effects of climate change, for example. I mean, we know that in the interior, most people do have air conditioning. It's a different story down here on the Lower Mainland. We know that newer homes and newer condo developments often have air conditioning. It may be something that we need to be looking at in terms of working with developers to ensure that that's in place. But the best thing people can do is check on their friends and check on their neighbours, check on their loved ones, and ensure that they're doing okay.
That we can take to cool ourselves down indoors, and I mentioned some of them. But longer term, we are looking at all of the data. We're working with the BC CDC, with the Coroner's Service, to understand, what is it about specific buildings or neighborhoods that make them more at risk? And we know that from the last time we had a major heat wave, which was in 2009. So we are going to be looking at all of those factors, neighborhood factors, building factors, and seeing what we can do longer term. That's not going to help us this weekend when we need to, as Minister Farnworth says, look out for each other and take those individual measures to help each other cool down.
Our next question today comes from Marcella Bernardo, News 1130. Marcella, please go ahead.
Hi, everyone. I'm not sure if Health Minister Dix is able to answer this, but we are hearing now that there is a national vaccine passport program that is in development, and how far do you hope that's going to go into encouraging people to get vaccinated, those that are still reluctant to do so?
Anything that encourages people to be immunized, that is important. It remains important. I will put in the plug for our immunization clinics this weekend. Some of them have been moved around so that they are all in air-conditioned spaces, and particularly in the interior where we know there's still communities at risk. If you are concerned about being evacuated, make sure you're immunized and you're protected, because we know that this virus is still circulating as well. And I'll let you talk about the national.
Just really quickly, Marcella, yes, they're moving forward with a plan for proof of vaccination for international travel, and we're a big part of that. We're working with them. We support them in that, and they support us. So it's something we're working on that we strongly support, and we're working to ensure that the details of it, of course, the requirement to have information accessible and to have privacy considerations taken into account, all of those things are in place. So the federal government and ourselves are working on it. I'm delighted to hear they announced it today, and of course we're very supportive of it.
Marcella, do you have a follow-up? Marcella, do you have a follow-up?
I do, and it's regarding something that was asked yesterday that hasn't been answered yet. We're trying to track down information about how many people under the age of 10 are hospitalized now, especially at Kelowna General Hospital, where we're hearing unconfirmed reports that there may be an infant in the ICU at Kelowna General Hospital. So hoping someone can elaborate on whether or not that's true and also when we can expect an updated plan for K-12 students heading back to
Thank you,
school
Martella.
in
And
less
of course,
than a month.
I know you asked that question on the Wildfire call yesterday, and I didn't have a specific answer for you. I can tell you that there are no children under the age of 12 who are in hospital in BC right now. In the interior, there have been 2 children, but both of them have been discharged. And we've had no children in the interior in ICU. So that's where we are right now. We are working with our provincial committee. We put out the framework in June in preparation, and we're adjusting as we are learning more about the virus that's circulating right now. The outbreak in the Okanagan, we're watching carefully what has happened there. As you know, the Delta variant is more transmissible. We're seeing transmission in a number of different settings, and we are very actively working with our provincial committee, which includes teachers, it includes superintendents, includes Ministry of Education, Ministry of Health, and you will expect to hear more about that later next week or early the week after.
Our next question is from Isabel Regum, CBC. Isabel, please go ahead.
Hi, this is for Dr. Bonnie Henry. Can you elaborate a bit more on how the use of fans can be dehydrating? And is there an inside temperature at which fans can be more harmful than useful?
This is something that people have been looking at for a time, because it does feel like having moving air can provide you with some benefit. But when it's hot air, it can actually increase your dehydration. But I don't know any specific temperatures. I know there's some more information about this on BC CDC's website, and I can get back to you with some of those details from Dr. Henderson, who's studied this way more than I. But I will say fans can be very useful if you wet yourself down first. So using a wet towel or sheet, or even putting something cool in front of the fan, like a tray of ice that cools the air down, helps you from that dehydrating effects of the fan. So those are things that people can do. Quite simple. I know what I do is put a towel in the freezer, and a wet towel in the freezer, and then you put that around your neck. That helps a whole lot. But also remembering to stay hydrated. So that means drinking water. Water, most importantly. For people who are on certain medications, like water pills for high blood pressure, they should check with their physician. But you also do need to continue to drink water, and you may need to have more during a period of time of heat as well. And those are really important things to think about right now. We know from other countries that some of the things that you can do for other countries that don't have air conditioning a lot, things like having a damp sheet on at night and putting that over the bed really does help keep that body temperature down a little bit when the temperatures are high at night.
Isabel, do you have a follow-up?
Yes, another question for Dr. Henry, and then Minister Dix, if we can please have an answer in français. What are your thoughts on the BCTF's call for a continued mask mandate inside BC schools in the fall? September's coming up, and what steps can be taken to protect school-age children who are not yet old enough to be vaccinated?
Clearly, this is
against
something
this
we
virus?
are working very hard on right now. There's a number of different things. We've seen a lot of the information and the data about what happened this past year. We are committed to the importance of in-class learning, not just for educational growth, but for emotional and physical growth. And we know it's so important for children and for families. So yes, we are looking at those details, what it will look like, but we also know from what we saw last year and what we see in communities that the other incredibly important piece is immunizing all of those who are able to be immunized. So children 12 to 17 or 12 and up who are in the school system, and importantly, all of the adults in our school system being immunized. That protects not just them, but it protects the school community, and it protects the younger children who aren't able yet to receive the vaccine. So those are the things that we'll be working on. We'll have more information coming out, as I mentioned, late next week.
Our next question comes from Mary Griffin. Our next question comes from Mary.
On a demandé quelque chose en français. Excuse me, Mary. I think we asked for the answer in French, so I'm just going to give that, and then we'll move on to you right away. Je dirais premièrement qu'il faut souligner l'importance de la vaccination en général. 82,2% des gens ont été vaccinés depuis le commencement de notre campagne de vaccination, et c'est important. 70% des gens de 12 à 17 ans ont été vaccinés, mais il faut que tout le monde être vacciné, bien entendu, qui peut être vacciné, et ça c'est important pour tout le monde. On travaille fort sur cette question de l'éducation, que ce soit au niveau élémentaire, au niveau secondaire ou au niveau post-secondaire. Et on va avoir plus à dire sur cela la semaine prochaine. Et cette décision est fondée sur deux principes. L'importance essentielle que des enfants et des jeunes être dans les salles de classe. Ça, c'est important. Et deuxièmement, de faire tout ce qu'on peut pour protéger et donner une dimension de sécurité pour tout le monde contre le COVID-19. Donc, on va travailler sur ces deux questions. Et bien entendu, je pense tard, la semaine prochaine, on va avoir plus à dire.
Apologies, Mayor. We just had to get that answer in French, so we'll go back to your question. Mary Griffin, Check News. Please go ahead.
Oh, thanks very much. Give me more time to read over my question. It's for Dr. Henry. It's just following up a bit on Isabel's question about masks in school, but I was talking with the president of the UVic Faculty Association, Dr. Lynn Martz, and they have sent out a petition because they want masks and vaccinations mandatory in all BC post-secondary institutions because there is such concern about the fall. For example, UVic has 22,000 students, 4,000 of them international students. So they're anticipating with classrooms as large as 300, there are going to be a number of students unvaccinated, and that's a concern. Just, Dr. Henry, is that I know you've been asked this a number of times, but they're looking to you in particular for direction on a mask and vaccination.
Thank you for that question
mandate.
again. And as I mentioned a number of times, we are working very closely with the post-secondary institutions. Again, we have a provincial stakeholder committee that is addressing these very questions. And we need to adjust as we are learning more, as we're moving through this summer, as we've seen the change in transmissibility, as we've seen the benefits, as we understand more about vaccine effectiveness and how well it works at preventing transmission, as well as preventing serious illness. And those are all the factors that we're looking at. We have plans in place, and we started working with all of the post-secondary institutions about making sure international students can safely come into the country, that they can be vaccinated. That's really important, and that we're able to assess and provide additional doses depending on what vaccines they may or may not have received in their country of origin. So those plans are well underway. Includes the provisions that we needed, as we did last year, for quarantine of some individuals, international students. So these are all questions that are currently under review right now, and along with K-12, we'll be having more information available in the next week or so.
Mayor, do you have a follow-up? Mary, do you have a follow-up?
I do. I'm just wondering, have BC colleges and universities been told not to bring in their own mandatory mask and vaccination rules?
We've never told anybody not to do things. What we have done is said, let's work together on finding the best possible approaches. And you may recall last year there was different mask mandates depending on the different programs that different colleges and post-secondary institutions had in place. So we are working again to try and have a coherent approach so that people know that we have an approach that looks at the different situations that we're in, and we'll have more information about the public health recommendations around that in the coming week.
Our next question is from Ahmad Agahi, Global. Ahmad, please go ahead.
Thank you so much. This question is for Minister Farnworth. I just want to go back the last two heat waves after each one. we experienced an unfortunate wildfire incident, that has basically had destructive effects on some small towns in the interior. This is another heat wave, and I just want to have you maybe say if you were doing anything more or if BC Wildfire is ready for what wildfire activity could follow it.
Obviously, whenever there is what we're seeing is an increase in temperatures and a drying trend that is taking place, and we're seeing this ridge building, is BC Wildfire is very much concerned in terms about when fires start. Obviously, lightning strikes are something that's not controlled, but clearly human-caused fires continue to be a concern because they are preventable in that regard. That being said, they are very much watching for where the key hotspots are and are prepared to fight fires as soon as they're spotted and as soon as they're reported in.
Ahmad, do you have a follow-up?
Yeah, just one more thing, and I just want to go back to the suggestion in the area of Monty Lake and the Paxton Valley that one of the most destructive fires, the White Rock Lake fire, was discovered by loggers and ranchers in the area, much earlier before it did take off, really, and they were given they were told to stand by and not fight the fire themselves. I just want to again ask if that is something you understand happened or not.
My understanding, that is not accurate. BC Wildfire was on that fire within 30 minutes of it being reported in. There was the briefing yesterday, which BC Wildfire and the Deputy Minister outlined the steps that BC Wildfire took in dealing with that fire right from the moment that it was phoned in. They were on that within 30 minutes. It was a very aggressive fire. It went from rank 4. It grew exponentially and ended up being a rank 6 fire.
Our next question comes from Kevin Griffin, Vancouver Sun. Kevin, please go ahead.
Hi, thanks for taking my call. I guess I was interested in the fact that, after the first heat wave in June, July, it's terrible that 568 people died, which was obviously horrible. What was the main takeaway from public health officials and provincial?
Yeah, I think if we look back on what happened in late June, early July, the intensity, the length of time, the type of heat and the buildup of heat during the day, it was a unique event. We had the highest temperatures ever recorded in Canada. So it is something that is something we have never seen in British Columbia before. Our previous experience, we do not experience heat waves in the same way that other parts of the country, my experience in places like Toronto in the past. So there's a couple of things about it. One is I don't believe our usual messages to people, like we're putting out today, were as understood as we now, having been through that tragedy, recognizing how quickly it can affect people, particularly people who are older, who are living on their own, who may not even recognize the symptoms. So there's a lot we can learn from that very unique event that was, as you mentioned, a tragic, unique event. And it's things that we can learn to help us for the future in how we plan communities, how we plan green spaces, how we plan buildings. But right now, I think it has made us realize the importance of getting out these messages in multiple different ways to people about things we can do personally with our family and the immediate term right now, and that's what we're focusing on. One of the key things that really was highlighted in some of the work we're doing with the coroner service in investigating the deaths was recognizing the indoor temperatures getting up so high, having that really quick in some cases within hours, fatal effect on people whose bodies can't adapt to that heat over a prolonged period of time. That's something we hadn't ever experienced in British Columbia before. So you will notice today the emphasis that we've put on things you can do to reduce temperatures indoors and to be mindful of the indoor temperatures as well as outdoor temperatures. So there's a lot we still have to learn. We're working with the BC CDC, the coroner service. We're looking at emergency department visits, hospitalizations, and EMS dispatches to try and understand patterns and areas where we can take action for the future. But right now, the important things for this next few days are to find ways to stay cool, both indoors and outdoors.
Kevin, do you have a follow-up? Kevin, do you have a follow-up?
I guess I just wanted to say that it sounds like, in part, it's calling on British Columbians to do some of this work themselves and not only to rely on official, public health officials and Ministry of Health officials, but to actually, call on their family members,
Absolutely.
so on, and friends.
This is something that affects large groups of people. And, the other unique thing that we experienced in June was the entire province was affected. And our previous experiences and our approaches have always been a regional approach because it's very rarely that it affects the entire province. Yes, there's only so much we can do, and we do have measures that we take for those people we know about. And Minister Dix talked about how we go out and we look at home care and people who have home supports, and we can reach out to those people. But it is particularly elderly people who are people with chronic health conditions who aren't very mobile, who are living alone in our communities that can be affected, and we have no way of knowing who they are. That's why we need to call on each of us to check on our own family members, our friends, our community members. And I know there are a number of groups, some seniors groups who are reaching out to each other, groups of people who spend time together. If you know somebody who is on their own, find a buddy system or a couple of them, and help out each other, help people find a cool place to stay, because it is not something any one ministry or any one government organization can do. It's something we all need to do. And this has been such a challenging summer. These are the things that affect not just our physical health, but also our emotional and mental health too. So this is a time where we need to come together again.
I would say, Kevin, there are significant things that we're going to have to adjust to as a province, and that means the government too. You'll note the very significant action that's been taken at BC Emergency Health Services because of what we saw during that weekend, but also really in this latter period of the pandemic since the month of May, with call rates that are dramatically higher than they've ever been before. The highest, I think the 20 highest rate of calls in the history of the BC Ambulance Service, and that means we've had to make changes to start to meet that demand, including significant new hirings, new ambulances, in addition to the very significant new hiring we've done over the last couple of years. With respect to long-term care, we need to, I think, and this is something that we're moving to deliver on, is upgrading the capital, the buildings in long-term care. As you know, there's been very little investment in health authority owned and operated long-term care homes over a significant period of time, and it's an issue of decades. And we have many long-term care homes, some of our best long-term care homes, that have moved past their useful life as buildings. And so we need to, I think, build and address existing long-term care homes, of course, to make sure that people are safe, but also build a new generation of long-term care homes. And so in terms of primary care, again, and other areas, we have to learn from this as a government. And it goes beyond within the provincial government and within governments. It involves municipal governments, it involves a number of ministries of government that are beyond the health system. We know and I spoke of the way that we deal with long-term care and people who are in acute care and the ambulance service and people who receive home care. But that will always be a small percentage of people in the province, even a small percentage of our elders, or a small percentage on any given moment of people with chronic disease, although they're connected to the system. So climate change is with us. We need a strong plan to address climate change. We have that, which is Clean BC. But we're also, all of us, government, communities, going to have to become more resilient as we see the consequences of climate change. So you've seen some of the actions we're taking, and you can bet we'll be taking more.
Thank you, everyone. That's all the time we have for today. Thank you for joining us.